Hello. Today I'll be presenting our research entitled Correlation Between Ultrasound Classification of Adenomyosis and Surgical Staging of Endometriosis. My name is Lauren Ditrio. I'm a resident at the University of Connecticut Health Center. I'm presenting on behalf of other authors, Megan Schmidt, Christopher Moraski, and Danielle Luciano. Endometriosis is a common cause of pelvic pain and infertility, which affects up to 10% of reproductive-aged women. Adenomyosis is considered by many to be a subtype of endometriosis, where the lining of the uterus, or endometriosis lesion, grows into the muscle of the uterus. Often, endometriosis and adenomyosis coexist, with past studies showing a correlation between the presence of the two. Various classification systems have been in use throughout the years. For endometriosis, the American Fertility Society surgical staging system for endometriosis has been in use for greater than 30 years. This uses diagnostic information about the extent of disease obtained at the time of surgery. However, until recently, adenomyosis has only been described as either diffuse or focal and diagnosed by pathology specimens obtained at time of hysterectomy. In 2018, a staging system for adenomyosis by ultrasound was introduced by Lazare et al. In an attempt to standardize the description of adenomyosis. Sonographic signs of adenomyosis have been shown to correlate with pathologic findings, and this method has been shown to have high inter-observer reliability. Our study goal was to investigate the correlation between surgical stage of endometriosis and ultrasound stage of adenomyosis in patients undergoing gynecological surgery. This was a retrospective case series. Included were all patients diagnosed with adenomyosis and treated surgically in a specialist minimally invasive gynecology clinic from January 1, 2016 through December 31, 2018. All included patients needed to have ultrasound images and operative reports, allowing for correct staging of endometriosis and adenomyosis. Archived ultrasound images were reviewed by a physician with extensive ultrasound experience, using the new ultrasound staging system to stage the patient's adenomyosis. Operative notes were also reviewed to determine the surgical stage of the patient's endometriosis. Pathology reports were used to confirm pathologic diagnosis of endometriosis and adenomyosis. Only patients whose ultrasound images and operative reports allowed for correct staging were included in the study. For statistical analysis, Wilcox and rank sum test was used for comparison of ordinal data between two groups, for example, to compare adenomyosis score between those with and those without fibroids. Spearman correlation was used for comparison between two sets of ordinal data or for comparison between ordinal and continuous data, for example, comparing adenomyosis score and endometriosis score, and comparing adenomyosis score with age, BMI, etc. A total of 124 patients with a diagnosis of adenomyosis were found in the chart review. Of these patients, 84 had a surgical diagnosis of endometriosis and adenomyosis. Of these patients, 71 had ultrasound images that allowed for staging of their adenomyosis. The charts were also abstracted for patient age, BMI, parity, previous cesarean section, and the presence of fibroids. Endometriosis staging ranged from stage 1 through 4, and adenomyosis staging ranged from mild to moderate, with scores ranging from 1 to 6. For our results, there was no correlation between surgical endometriosis stage and ultrasound adenomyosis score or stage. Further, no correlation was shown between age, parity, or presence of fibroids with either endometriosis or adenomyosis stage. There was a significant correlation between stage of endometriosis and parity, with a higher parity seen in lower endometriosis stage. There was not, however, a correlation between parity and adenomyosis stage or adenomyosis score. There was a correlation seen between history of cesarean section and higher adenomyosis stage and adenomyosis score. In conclusion, our study does not show any correlation between adenomyosis score and endometriosis score. Although adenomyosis is described as endometriosis interna by many, there is some debate as to whether the pathophysiology of endometriosis and adenomyosis are the same. This study did demonstrate a correlation of having a prior cesarean section and adenomyosis stage and score, suggesting that surgery on the uterus might contribute to the infiltration of endometrial glands into the myometrium. A goal of this and of future research is to understand the degree of adenomyosis without requiring invasive surgery. Traditionally, the classification of adenomyosis as diffuse versus focal involved hysterectomy. The new adenomyosis scoring system is by ultrasound, which allows for diagnosis and staging of patients who are not undergoing hysterectomy and may not desire that definitive surgery. Correlations seen in this study have also been described previously, for example, higher parity and lower endometriosis scores, as well as having had a prior cesarean section and adenomyosis stage and score. However, no correlation was seen between parity and adenomyosis score or stage. Continued study of adenomyosis and endometriosis pathophysiology may help elucidate a connection between these two disease states. Thank you for listening to this presentation. Please feel free to contact me at the email address listed below with any questions.